We are back at MindMomBodyRN, and I have my dear friend and doctor here, Dr. Vanessa Knoedler.
Knoedler. But I like Knoedler best.
Knoedler.
I want to change my pronunciation of my name to Knoedler. No, I mean in like life. I'm like thinking about it.
Knoedler.
But it's pronounced Knoedler.
Okay. All right, we're back with Dr. Knoedler. MMBRN, here we are. Let's go. Let's roll.
Hi, Vanessa, everybody.
Yes. So give a little bit of your background. You have a very impressive background.
Oh, thank you. I'm Vanessa Knoedler. I am an OBGYN. I did my training in New York at New York Medical College after doing some research at Harvard Medical School for a couple of years. And then I went and did my residency training in South Chicago at the Mercy Hospital, which is no longer Mercy Hospital. It was going to close, and then I don't know, it got saved at the last minute, but it's no longer named Mercy. So if you're Googling it, you're not going to find it. But it's a great hospital in the south side of Chicago. And then I worked in my own private practice as a physician owner for 11-ish years. And here I am now.
Here
I've been
you are now.
employed at another place. And yeah, I'm doing locum tenens work right now, running around. And
you're podcasting.
And I'm podcasting. I'm writing a book. I'm doing a lot of tarot readings for my friends.
Yes.
It's a complicated life not working a regular job. You get a little weird.
Especially when you have only ever worked crazy hours your whole life.
Right.
Like
it is funny because the first week I was like not working 80 to 110 hours a week. I was like, what am I going to do? I think I'm going to read tarot cards. And it's like 3 a.m. and I'm like, these are interesting. But I don't have a lot of rules here but my free time. So
I love that.
Yeah,
also, it is like a whole new thing that therapists that read tarot.
Oh, really?
Physicians that read tarot. It is a whole thing. Yeah.
They're trying to bring some energy work into it, like bringing Reiki into an acupuncturist's world. Fascinating.
Yes. I love it.
That analogy is imperfect, I'm sure.
So today we're talking about, because you've seen it all, she's seen it all. I also wanted to add the caveat that she delivered my very first child.
I did.
She did. And yeah, it was just, and so wonderful. So I have had
She's a cutie.
She is. Is it because, it's probably because you touched her first.
She's a spitfire, yeah. No, I mean, I assume I lay my hands on them and give them some of my energy.
That is why. I'm definitely sure.
It's all positive.
Yes. So can we talk a little bit about birth trauma and how you've seen that play out, how it can be avoided, but also validating women who've experienced it and naming things that you've seen? I just want to let you go on like a monologue about it.
Sure. Yeah, so birth trauma is fascinating, and I think it's underrepresented in terms of the PTSD world. I don't have facts or stats on that right now, but I do know that it's undervalued grossly, not by the physicians who are trying to treat it per se, or by the patients, or by the community, but actually by all of those people, unintentionally, invalidating serious physical, emotional, social trauma at a time when, you want to be experiencing great things. You're worried terrible things will happen. You've certainly heard stories. It'd be hard not to. And the media, from your friends and family, from everyone in your life and from every aspect, and to go into it and then suffer a trauma and then to have that trauma negated. I mean, just think of everybody and what their personal trauma is and what you have had to do to fight to have that acknowledged, and then add on to that a bunch of people going, oh, you'll heal up just fine, dismissing it on so many levels, that people really do not get the validation they need on every level. So I like to start from a place of acknowledging that, because I don't think it's valued enough. And I'm sure there are patients, I always think about my patients out there. And I think a bunch of women right now are happily saying, yes, you helped me with my birth trauma and thank you. I'm sure there are patients I did not help enough, and that's something to think about. Like I'm positive as I say that, I think about the people who maybe were not, given, this fullness of understanding that I have come to now, because I just didn't know then,
Right.
And now I do. And I feel for those people, because I hope we all get help for our trauma. I'm not trying to castigate myself here. I'm just saying, you got to acknowledge all these different parts of how complex this is. And when you have 15 minutes for a postpartum visit, I have no idea how you're supposed to get through the physical and emotional connection with a patient of truly understanding what they're going through. And I've spent 45, 60 minutes or longer with patients who've had birth trauma in my clinic, canceling other appointments, rescheduling things, because it takes forever to get to the heart of what it is and the heart of what we can maybe do about it. Some really interesting things I would say about it is, I think many women say, my vagina is just fine. Let's just talk about the physical trauma of your vagina, not the emotional trauma, the trauma to other parts of your body. Let's just talk about our
experience.
Vaginas. Yeah. There are many, many parts to this trauma, but let's just talk about the vaginas. What can happen to the vagina could be really, really, really traumatizing physically, emotionally, sexually, lifelong. It can affect your bladder. It can affect your bowels. It can affect so many things down there. I think about one woman who came to me, and I think she was somewhere between 5 to 7 months out from birth. So think about that, 5 to 7 months of your life. And then think about what I'm going to say.
That's my youngest.
Right. So how long has that time been? 5 to 7 months of play dates with the baby, and, the beautiful sky above you, and you're rolling around and you're outside and you're playing and you're doing things and you're able to, because although you went through birth, you are still able to be a human. And, this person, she was not able to be continent of stool. She could not keep her poop in. Her bladder was not functioning right. And she tried to have sex once or twice, and it was like knives in 5 to 7 months. And that's not what she was coming to tell me about. She was complaining about some bleeding problems. But as I started talking to her, I was like, hey, you said a few things about your vagina that concerned me. Could we just does that bother you? And after examining, there's such exhaustive trauma. I mean, it was extensive. It was from the opening all the way up, and really devastating, and required a massive surgery to repair.
Were you able to repair it?
We were able to repair it to an excellent place. However, that was in question, right? And I spent hours and hours doing that with uncertain results. And she, of course, knew that. We took the risk and we got a good outcome, and we're very thankful for that, as a team. But I think the psychological trauma of that can never leave someone. They can heal. We can all heal. And I'm not saying you're broken. I'm saying the opposite of that. I'm saying acknowledge that once trauma occurs, it never leaves every bit of your cells somehow. It never leaves every bit of your neurons in your brain. Maybe you feel really healed. You feel really good. But maybe there's way more to it than that if you want to get into it to heal fully from such a thing. If that kind of makes sense. I'm saying it very vaguely. But I think that acknowledging that emotional trauma and moving through the therapy of it, the medications, the time away from work, the time at work, and what that means, for a human who's gone through that, I'm very thankful that this person was able to do that, but not every woman is able to do that. And that's a good outcome from a really bad situation. Now, is that everybody's birth trauma? Absolutely not. Many women simply have changes to their vagina that they find to be, mildly annoying to what I'm describing, which is horrifically life-altering, But I will say that a lot of women, I think, are taught to stoically and systematically ignore the changes that happen to their vagina instead of acknowledging them. They can even celebrate them. One of my friends said something once about his wife's stretch marks, the changes in her abdomen, and how he was like, that's just the sign of our babies and how she made them, for the world, this kind of beautiful tribute. And I'm not even doing it justice. He said something much more eloquent, but that's my takeaway.
Yeah.
And so there is a celebration that comes with change. There's a celebration that comes with scars. And certainly the scars of childbirth are something that we should, and, it's the only way we get more life on this planet. We certainly should celebrate it in some way. But at the very least, we should acknowledge it, and try to help people move through it and past it, or whatever that means. I'm saying these words, I'm sure, are an imperfect understanding of how to get through and into the next stage of how we deal with our trauma. So I don't intend to say we should just get past it, but I mean, we should be able to functionally say it, name it, and then fully, truly get past it.
Right.
If that's your journey.
Yeah.
I don't want to tell everyone they got to sit there for 5 hours of therapy because they had a baby and their vagina is different. They might be like, brah, my vagina is dope.
Yeah,
Leave
I'm
it alone.
good. Yeah.
I've checked it out from top to bottom. leave it alone.
But that you're creating like a sacred space for people who don't feel that way.
Exactly.
Because it's more likely to not feel that way. If you feel that way, awesome, good for you. You are in the minority, and I am like so happy that's not something you're struggling with.
Exactly.
But can we kind of talk about what should someone expect from their vagina, health-wise, how it should feel, healing-wise, 6 months out? You should not be incontinent. There are things we can help you with.
Right.
Yeah. Can you go into that?
Exactly. So I would say, there are so many stages to this, and it's a day by day. Our bodies go through this bizarre smorgasbord of hormones and physical and emotional changes after we have a baby. We have literal changes, that are measurable and demonstrable, physiologic changes, meaning like your blood pressure is changing, your heart rate's changing, your uterus is getting smaller in size, you're bleeding more frequently than you would during a time when you have your period, you're not using your vagina for anything. It is healing, it is, a place that's likely had trauma, maybe has had stitches. And even if you have not fully given vaginal birth, let's say you got to 6 or 7 centimeters, and then you unfortunately had to have a cesarean, which you didn't want. Right?
Yeah.
Hopefully with a doctor who loves you.
Yeah, right.
Hi.
Yes, hi.
Hi.
Welcome.
Yeah, no problem. Anytime. So, you still will have trauma to those areas.
And your cervix.
And, your cervix and your vagina.
Right.
And your pelvic floor. An area that we teach in medical school by layering paper on top of each other. Because the best way we've gotten to is saying there are thin little fibers of muscle, and they're kind of like paper layered on each other, and they do very important things, and we don't know what they do, really. Not every day. We don't understand, the pathophysiology of this, that, and the other thing. And we certainly do not have enough studies on birth trauma, because only 2% of our American healthcare research dollars go to women's health research, right? And 11% of NIH dollars. We don't know, and we would love to know. But what can happen is your vagina, for the first couple of days afterwards, is going to be sore, swollen. It could be huge on the outside, swollen from the inside to the outside. The vulva could be very swollen. So think like your vulva is usually like loose, flappy skin, or maybe like a tighter, more like, meatier kind of layer of skin. Everybody's vulva is different, longer, shorter, meatier, thinner, etc. But they're not usually big and swollen like, a line of grapes. Underneath your tissue. And well, that's not normal. It's a variation of what can occur, after we give birth. And so for the first few days to weeks, your vagina is going to be sore, swollen, it's going to be squirt bottle only.
Peri bottle.
You got to put that bottle between your legs, soak in the tub, Epsom salts plus or minus, whatever you want to do. People can weigh in on that. Coconut oil plus or minus, weigh in on that.
Olive oil plus or minus, weigh in on
sure,
that.
Man. Talk about all these different options. It's too early for physical therapy. It's too early for sex or tampons, and the area needs to go through physical changes and healing. And then the first few weeks, is just kind of a continuation of that, up to about 6 weeks, when your uterus, your vagina, the clitoris, the labia are usually healed. We're talking preliminary healing there if you've had a big tear, or not healing, like my poor friend and patient who had, the big, destruction of tissue and area within her vagina at that 6-month markish. And then you're going to heal slowly as the months go by. And somewhere in there is going to be when you feel like resuming sexual activity. Somewhere in there is when you're going to be fully continent of urine, meaning I'd say normal, but not great, is being slightly incontinent of urine sometimes, or most of the time, right after birth for the first couple of days. The massive trauma, the massive swelling, maybe the nerves have been shocked around the bladder. It's a very generic thing I'm saying, but it's based on the nerves around the bladder are very sensitive to many surgical and physical things that happen to them. So it just stands to reason that the physical shock and trauma could be part of the problem. But it's not normal to be peeing yourself 6 weeks out, 12 weeks out, right? That's a problem. Now, I'm not saying you're a problem. I'm saying your body has gone through a change. And now physically there is an issue that is altering your activities of daily life. And if you do not want to live that way, I would understand that. And I would be there to help you,
Right.
you know? And I think even getting through what we just said is more than most patients and most doctors can get through in a visit, just for a variety of all these human reasons, right?
Right. So in a perfect world, how long would you have for a postpartum visit? If it was a perfect world?
Just hours, and with more than one woman.
Yeah.
Right. So part of it has to be personal and undressed.
Mm-hmm.
But just like centering birth, I wish we centered postpartum time. Mm. And I think HCMC, the Hennepin County Medical Center, it's a county medical center in Minneapolis. It has many of the qualities one would assume, the quote unquote negative qualities of that, meaning it's downtown, it's urban, it's gritty, it's got a lot of things going against it, but it does amazing work in many areas. And God bless them for doing the work that not everyone will do that we need to get done.
Yeah. And shout out to the Mother Baby Center too, because that's like creme de la creme of.
Absolutely.
Yeah.
And HCMC has this amazing postpartum program. I feel like I'm hawking it. I do not own stock in any of these things.
Yeah. Or that's what I meant to say, the Mother Baby program. Yeah.
The Mother Baby program.
Yeah, that's what I meant to say.
It's called Red Leaf now.
Yeah, okay.
Through HCMC, they renamed it.
Okay.
So they have people come in group sessions, and they come every day. Mm-hmm. And I have seen many women who are going through life crises. Like one woman, we thought it was severe postpartum anxiety. It was, but it was due to acute domestic violence instigated by the birth. You're not blaming the baby, but you're saying, some people, will have behavior changes around birth, and some people who have abusive tendencies might ramp it up. Right. Mm-hmm. So it's just acknowledging these things. And she got through that time, was able to label it, name it, separate from the negative situation, and create a safe environment for herself, because she was acutely mentally ill due to a variety of factors, and she was able to avoid inpatient hospitalization during that postpartum time. Mm-hmm. So you think about this, you have a baby and everyone's like, how was your birth experience? And the only people who get to answer that happily are people who had the birth they wanted, their planned cesarean they wanted, their vaginal birth that happened in a tub at home through spontaneous labor, you name it,
right.
Whatever your birth is, you wrote down your wants and you got it. It's like winning a lottery of sorts, right?
And even if you did get everything you wanted, you've never done it before, so you still might have trauma from it.
Just from the newness of it and the extraordinariness of it. And what a huge responsibility. And
right. And just that blew out my vagina. Just even though it's natural, maybe even if I didn't tear, that experience of having to surrender so much.
Yeah.
And that can be huge. Even if you did, maybe you said I didn't want an epidural, and then push came to shove, and it's like, you didn't do the epidural, great job. And it's like, yeah, but that was really horrific for me.
Right. I now feel like I wish I'd had it.
Right.
I'm looking back on it and wishing I had, and it's so interesting. We could spend days talking about birth plans and coming from very different perspectives. But I think that the reason generically the midwives and I, the family practice docs and I, the patients and I, generically, not saying everyone, but, get along really well is because I'm like, yeah, man, what's your dream? Let's try to make it happen within safety regulations. You know what I mean? And I mean that because why would I want you to have the birth I want? That makes no sense. Right? I will never understand that concept of a doctor putting something personal, and then pushing it on someone. So there's a million ways it could go wrong. Mm-hmm. But I wish our birth plans were more centered around within reason. This would be great. I really wish people thought more about the asks as opposed to the musts, because life happens and no one has control over that. Not a lay midwife, not a certified nurse midwife, not an MD, not an FPOB MD, not a CNM, I don't know. Whoever else I didn't label. I'm so sorry I didn't label you. PAs in California can deliver babies.
Yeah, right.
Whatever.
Yes.
All the folks, the people in the middle of nowhere who are just delivering babies because they're present. Everybody who does this together, we can try to make this the best experience possible. And that includes the postpartum time, which is so ignored. It's funny that you asked me to talk about that today, because it's weird. I didn't spark immediately to, what my life goal is. So my life goal, I am not personally a parent, but I've helped thousands of babies come into this world, and I see many of them frequently. And, I feel very much a part of the cycle of life and my part in it, and I really think sometimes I get to see it from a perspective that mothers don't.
Right.
So there's a value in that.
Yeah.
Although I respect the heck out of people who've gone through it, and lived experience is a totally different thing. But I'm just saying,
I would disagree.
Maybe it's more scientific.
You are a mother in this village.
Right.
You are a mother in this village.
Kind of
you have
mother
not. Right. You don't have biological children.
Well, and you're a mother if you adopt a child. You're a mother if you have a cesarean. You're a mother if you push your baby out of your vagina. You're a mother if you're a mother to a child. Some people push babies out of their vaginas and never acknowledge their motherhood and never are, in a way.
Yeah.
So motherhood is complicated.
It's super complicated.
But I say that because my fascination is with this postpartum period and the patients who've done really poorly. I have not been the one to always help them. I talk about that success story. I could tell you way more failure stories. And I feel like they're my failures. I know they're not 100%, but a failure of the whole darn system, me included, of trying to get people better care in the postpartum period and being just grossly unable to do so.
And I think
within reason.
Right. And I think that a lot of it's doctors. Well, doctors.
Yeah.
And I think just to humanize your position for a minute, from your perspective, can you maybe talk about a time where looking back, you realized that maybe a patient needed something in the postpartum differently than what you gave them?
Oh, absolutely.
But give some perspective on how much pressure is on you guys, how many patients you see a day. And this is not because anyone's trying to make mad money. It's because there's not enough providers for how many patients there are.
Right. And you actually care, which is why you do it. And you're taught to try to not care in a way, to be more scientific about it. But you have to care, and caring is part of giving the best care, because caring is saying science be danged, this patient wants that. And if it's within reason, I'm going to fight for them to make that happen. After explaining all the risks and benefits ad nauseum, I can actually give a very concrete example. I told a patient in the postpartum period, I was a newer doctor. I just graduated a few years before, but I wasn't new. And she told me in a postpartum visit that she had thoughts of harming her child sometimes. And I ended up talking to family services about it. And we were never in a relationship as a doctor and a patient again. And I can totally understand why. And I always wished I could have said in that moment that I actually had a patient who she ended up being involved in the death of her child. Very directly, through direct trauma, due to postpartum depression, anxiety, and mental illness. And none of this is HIPAA, non-compliant. There are no details here. But I can't run around telling everybody everything about why I do something. But once that child died, a part of me was I don't know where my line is in respecting a woman's autonomy and trying to take care of her child at the same time. And I'm not very aggressive. And I can tell you on one hand how many times I've spoken to child services, which means I've tried to find other ways, of helping people through whatever they're going through. I am a mandated reporter of direct abuse of a child, but that happens very rarely that someone shows or tells me that. And so it's just really rare. And I hope my patients understand, gosh, what a bind. I want to help you as a human, but what a legal and emotional, and I can't lose another baby that way.
Yeah.
When maybe I could have helped someone with whatever mental health they were going through that was none of their fault.
Right.
And help them and their baby. And it's not the perfect way to do it. And it's not the perfect situation or story, but these are very real examples.
Right.
And that was one of my 15-minute visits in an 8-hour day.
Because you didn't have 6 hours to unpack that with her. You just didn't. You couldn't.
And she deserved a care team involving a doctor and a social worker and a psychologist and safe place to be.
And that's what social services can provide.
Sometimes, right?
In an
imperfect way, in the way that we can in America today, which we know isn't perfect enough and not good.
Yes.
Through all of these mistakes that are made by the system, made by me, made by nurses, made by patients, made by all of us together, it's this big hodgepodge, trying to avoid the blame of how terrible it is and where it all came from, but rather trying to fix the level and trying to think about this kind of newly very fashionable concept of being very local, which isn't just newly fashionable, you know, and I know it's about supporting people where you are, and you can use international, you know, world things, you know, politics, paradigms, you know, giving money and charities and things like that. But I'm saying, like, on the local level, how can you make something sustainable? Right?
Yeah.
Could you create community centers in your community where you have a postpartum support center? So that's what I would really like to do. So my passion project is I would like to make a very like circular center. You know, I'd also like to make a circular center for my business model. So they're not like but they're two separate concepts. You know, what I'd like is a circular center where like you have plants and water and calmness and a safe space. People who can care for children in a safe space nearby, but not so nearby that you hear that happening. There are spaces for that where the sound of children's laughter is healing. And there is a space, I think especially a postpartum place.
Where it's grating.
Where it is terrible. You need to be in quiet, safe space. So instead of committing people to institutions, encourage people to go there every day, whether they feel good or they feel bad. Just stop by the postpartum center. And if they feel bad, maybe then push a little. You should go to the postpartum center, right? Like, not because you're sick or wrong, but like, you look tired, man. And tired can become anxious, and anxious can become angry. And angry could snowball into a chemical psychosis, not that you caused. I'm just saying, what if it's preventable? And I'm assuming a lot of it is. Now, I'm not saying we could prevent everyone's bad outcome, but I mean, that's not the point. We lack community. We lack connectedness. What if every old lady who's sitting alone, right? I'm 44. I'm moving into old ladyhood without kids. No,
Don't say that.
Don't worry about it. It's fine. I'm super embracing it. I'm having my midlife crisis about it. What if everyone who's sitting out there like me with my cat as I age, you know, wants to spend their Wednesday afternoons at the postpartum center? You know, what if they want to go there and they don't necessarily want to talk to people? They don't necessarily they want to prune the trees, or they want to bake the bread, or they want to take care of the kids because they love the sound of children's laughter, and it never grated on their nerves. And they had 25 children of their own. They adopted 22 of them, and it was amazing. You know, sure, great, yay.
And they're like a village mother, like you.
Exactamente. Like, you know, everybody just needs to give what they can. And if we all took those joy moments, like if we were like, look, every woman in the community, let's start there. You know, hopefully it's every person, right? So everybody who needs this center, you know, it needs to be a safe place. There are areas where maybe every gender is welcome, right? I mean, and you hear me, I'm always all gender conscious, you know, like, or I'm trying to be, and I'm sure I'm saying it wrong. So assigned female at birth, anyone who identifies as a mother, someone who's suffering from postpartum depression of whatever variety it is. And hopefully we could expand services to everyone, you know, families who are exhaustively suffering from postpartum depression at home, of one person, of the mom, of the dad, of different varieties of depressions, you know, of trauma, labels. I'm just saying, whatever is going on that is negative in the postpartum period, let's help people have a safe place and have that be a place where you can imagine so much could be done there. Right? There's a kitchen table in the back where people are cooking because everybody needs to eat.
Yeah.
Maybe the kids need it. I don't care who's eating. Everybody should eat, you know? Maybe it becomes a place where communities gather for communal dinners, something we really miss out on in American society. Maybe this becomes something so much more than what it is, where there's a huge safe haven, and then there's a tiny little 5-foot walkway to technically separate the two buildings. And then there's just like the big wooden tables where everybody can eat, men, women, children, aunties, uncles, grandmas. Sometimes the new immigrant couple that moved in down the street doesn't have X, Y, and Z yet. They showed up today and we're like, hey, FYI, we got some pots in the back. Do you need a pot? You know, like there's so many ways that this snowballs into caring for each other in so many ways, because what I see is women suffering from postpartum and depression and anxiety that could be ameliorated by support. Yeah. And maybe they need drugs. And I say need loosely. I'm just saying maybe it's more than that. But what they are lacking, and I think what could prevent so much postpartum anxiety and depression, and let's be honest, lifelong repercussions from that, right? Then you never get off your Prozac and you're like, I don't know, I'm still reeling from my birth 7 years later. Is she really 7? And I'm like, well, you never went through the trauma, and maybe you never can, but you never even got through it a little bit.
But maybe you've been on autopilot
But maybe you've been on autopilot, dumping down that serotonin, et cetera, you know, really trying to make things work every day. I applaud you, but you're right. And what if that could have all been prevented? You know, what if skyrocketing rates of depression and anxiety, which we know are related to antisocial behaviors, to sedentary behaviors, to poor diet, to foods that aren't foods, highly processed foods or whatever the labels are, ultra processed foods. I'm sorry, I forget all the modern labels. Right. Things that just make us addicted to food and depressed, alcohol in excessive amounts, drugs in excessive amounts, these things, that people are turning to in these solitudes. And then we see skyrocketing rates after the pandemic, and something as simple as a postpartum center. Who could that heal? Everyone who shows up.
Right. You have, like you said, you have like the village moms who it's like a mom comes to the postpartum center. Maybe there's also a locker room where she can get a hot shower while she knows her baby's safe.
Exactly. All of it. Beds, multiple quiet bed areas, walkways that are peaceful and only with people who are wandering around peacefully, right? Because again, the area with the kids is somewhere else. This is a safe space.
Right.
And maybe it's just a dark room and a meal. And maybe it is 20 friends and you just need to cry for 5 hours. Maybe then after that, it's a shower and a meal and a bed in a dark room.
It's whatever they need.
Right. But it's just a center where everybody's going through it together and everyone's sensitive to the environment at hand, which is unique. Whereas at home, you can't be sensitive just to the grieving postpartum mom. She is inherently so alone in a way she does not need to be. Her children still need to be in a 10th grader and a 2nd grader in spite of the fact that she just gave birth. Her husband still needs to do X, Y, and Z, whatever his roles are, working, childcare, whatever roles he has in his life. They cannot stop and properly care from that woman. But a 60-year-old who's been through it twice, who's retired early and bored on Thursdays, maybe wants to come down, or maybe we pay her. God for flipping bid. We bring money into this.
Jesus.
I'm not swearing.
Right.
Because I'm talking to patients, right? I usually swear more in my normal life and less with my patients.
But it's true.
Not
I mean,
completely.
For God's sake, what if she got compensated?
God forbid.
For doing that, right? But I think that like what I'm really hearing you say comes down to like what MMBRN is. And like just at the very basic level, it is mothering the mother.
Right. It's mothering. It's taking care of a holistic set of people, meaning everyone.
Right.
And maybe making community.
And what you're creating, though, sounds like home.
Right.
You create a place where you can come home, what feels like home, and be nurtured.
And be safe.
Because
at the end of the day, as someone who's suffered her own trauma, as I'm sure you have, as I'm sure everyone listening has, because no one is without their trauma, sometimes you need a safe space. I was talking to one of my business partners once, and she's just extraordinary, and she's gone through a lot. And personally, she's a fascinating person. She'd purchased a medication from a different country because a patient needed it, and then she nearly got thrown in jail. And these things that happen that I understand, and it's more complicated than just one thing or quote unquote doing right. We need rules.
I feel like you just need to give a tidge of context because it was from a country that has higher FDA standard. Okay, it was from Canada that has a higher FDA standard than we do.
Right.
So it was literally purchasing from Big Pharma that's even more particular than we are. It's like the better version of we have, and she got in trouble for it.
You don't trust Canada, but it's not about that. I know it's about laws and different things, but like it's people who are trying to do the right thing, and it's so hard to do the right thing. Mm-hmm. And the example that, now I lost my example because we went too far into the Canada paradigm. No,
your
it was
friend
fascinating.
Who,
I know she had said to me, no, I lost it. I'm sorry. No, I just lost like her little like moment of wisdom that she was trying to give me. We talk a lot.
And safe. Anyway. And going back to the postpartum center.
So going back to the postpartum center, so it's about having a safe place because no matter what, when we experience trauma, I would argue, after going through therapy myself and reading about it and studying psychiatry in medical school, although not in residency or anything like that, beyond the basics, is that when we suffer trauma, we seek a safe space. And you need a mental safe space. But what if we created more safe spaces that were specifically designed to help people not be traumatized? Would that be so horrific? Think about people who could like, now let's expand just that basic theory. Children who are on the spectrum who suffer from auditory and excess stimuli.
Right.
Safe places. dark, safe places within the world, within the community.
Right.
And no, that is the room without noise. Guys, you got to be respectful in that place, right? You can't go in there unless you're going to be noiseless. That's just not the space that it is. And we have to treat it as great disrespect. Like if you go in there and you violate those rules, or more importantly, why would you go in there and violate the rules? Because you got a bunch of places where you want to go, because there are safe spaces for people.
Right.
And I think that paradigm is the 15-minute city. I think it is the small community. I think it is farm to table. I think it is local healthcare. I think it is local business. It is local banking. It is, et cetera, local. Mm-hmm. I think that's where you try to get away from what Jeff Bezos and Elon Musk have tried to create. I'm not trying to poop on them all the time and shit on all their ideas, but let's be honest. Anyone who's 84% richer after the pandemic isn't doing things right for life, for humans.
Yeah.
For them, sure. Congratulations, guys.
More money.
Enjoy your blood. Money.
Yeah.
One
thing I wanted to ask you about is in terms of we have just you and I personally have talked about these rural pockets of healthcare where healthcare deserts. What do you see happening with that, and what needs to be done about that? If you could speak to that.
Well, again, postpartum centers, it's the idea of centers, because you need places where you're not giving healthcare in the way that it's given in a hospital. So from the highest level of federal regulation, right? The AMA needs to do something. And I get it. I'm sure they are. But obviously it is not panning out to fixing what we do not have, which is 159 out of 250 counties in Texas don't have an OBGYN. Not don't have enough, don't have one. Not one.
And that's just Texas.
Just Texas. And that's going to get worse. That number is pre-pandemic or early pandemic, and definitely pre-Dobbs. So that number is going to change.
Dobbs.
The Dobbs decision overruling the Roe v. Wade decision, which made abortion illegal in America. Well, I'm sorry, to be very specific, it made states able to create laws to make abortion illegal in a state-by-state basis, whereas before that it was considered a federal right because of Roe v. Wade. So since that has happened, we're going to lose probably more OBGYNs from Texas. So if we have health deserts, if we have places where we cannot have hospitals, and we insist on only making capitalist hospitals, we cannot consider a single payer option or, federalized healthcare. All right, fine. Nobody wants to do that. All right. The alternative is this. It's capitalism. So we can't afford to make more hospitals because they don't make money, or they pay their CEOs $13 million a year, or so they probably could make money, but people argue not without that CEO. And I'm like, well, they're not winning with that CEO. So I guess I don't understand the salary to return on investment of that one, but sure. The money is going to all the wrong places is what I'm saying.
That's
it's just going to all the wrong places.
What it comes down to.
So you have to start from a federal level and say, well, without federal regulation, apparently states are going to do whatever they want like children, not like adults, because that's what happens, apparently.
And that's age appropriate for children, but not for grown-ups.
Yeah. I concur.
Yeah.
Or you get states like Minnesota where you just put vast sums of money into giving healthcare to everyone. But we run with a surplus every year. So suck it.
Yeah.
Everyone else, nice blue state we got here. And so that's definitely my first thing. But if you're thinking well, what can we do? It really is, I think, trying to create a model of local healthcare that isn't healthcare, so thinking groups of people, just like this postpartum center, who are not healthcare professionals, who aren't going to be able to recognize suicidality or psychosis. I'm not intending to replace healthcare with random chicks who live down the block who are 85, Mrs. Fig from Harry Potter being I'm a squib, but I can help. And you're like, all
look
right.
At my cat photos for hours.
It smells bad, like cat piss.
Yeah.
I'm saying if we think about it differently, maybe we can avoid some parts of healthcare that are undernourished anyway.
Right.
I'm saying if we put dollars towards this, but that's going to have to start on a, donation level, going to the, Gates Foundation, the Buffett Foundation, and being like, hey guys, can we have some money
to stay alive?
Keeping women alive, because then they could have more babies. If that's all you think they're useful for, let's use that as a selling point.
Yeah.
If that's the only way you give them value,
alive so they can stay pregnant.
Do they keep a man happy or create children for the world? Oh, they're useful, you say.
Acceptable. Ooh. We shall not send them to the colonies.
The Handmaid's Tale.
Yes.
Always comes back to it.
Yes.
As it should.
So what I wanted to wrap up on is so we have that postpartum person, right?
Yeah.
That is in that dark place. That is like, how do I tell my OBGYN how dark of a place I'm in with this short amount of time? How do I really get to the point of I need help?
Right.
What is the best way for that patient to,
say something?
Yeah.
I think it's very difficult. I think the most basic level is, and the reason it's difficult is people say, well, what if I run into a gynecologist who says, well, she just needs to be committed. She sounds so crazy. And I would say, the only time a gynecologist is going to do something like that, unless they are being unreasonable, which could happen, is if you say you're going to hurt someone.
Or yourself.
Or meaning yourself or anyone else,
right.
And so everything else is a conversation you should be able to have. But the hard part is you need hours of time to explain it. And you don't have that with your doctor, right? So the best thing I would say is you have a lot of things to say and you have a lot of emotions that are going to come out either way. And the doctor hopefully is very open to that because they're a gynecologist and they darn well should be. But it's hard for them too as a human because they feel a lot when you cry. And that's not blaming anyone. That's just what it is, man. Like, let's just name it and help move past it. So like, if you can write down ahead of time 3 sentences or 5 words or anything that explains your real fear. I'm not sleeping and I think I'm becoming a zombie. I feel dead inside. The doctor is not going to be like, well, you're broken. You're like a broken toy. Get out of here. A good doctor is going to go, okay, let's look at your list of problems. And they're going to say, okay, I've looked through this. I see some warnings left, right, or up or down. But at the end of the day, anyone can start right now with this list of complaints, because no matter what that list of complaints is if it falls in the categories of anxiety, depression, any kind of postpartum issues of that variety, someone could start with one-on-one therapy, daily group therapy, like at HCMC, at Red Leaf, or with a medication, or with all the above. Or none of the above. And you go home and you talk to people about it and you consider all your options. That's always number one.
Or you call
listen to what I said. Yeah, call all of us. But going home and thinking about your options, I think a lot of my surgical patients become my surgical patients because you should say this after every consent you've gotten from a patient for everything they do, but is you don't have to make a choice right now, except in extraordinary circumstances where choices must be made right then. But in clinic, it's never an emergency. And then people are like, well, do I have to decide right now? And I'm like, you never have to decide anything. I could walk in with a scalpel and you could say no. That's the point we could be at and you would say no. Consent is very important. But the most important consent is understanding what the heck is about to happen, which means you go home and think about it. Make sure you understood what I said and arguably, hopefully have another visit with me. And that is where the trouble comes in. There's no follow-up appointments. We don't have psychiatrists available immediately. We don't have psychologists available immediately. And that's when you need a good support group at home or with friends or in emergency cases with, professional psychiatric care. And that's that liminal space I think we need to get into.
The caveat I did want to make is that a lot of women have thoughts about hurting their children. And hurting themselves. And being committed is not a bad thing. If that is what you need. There is no shame because it's not you that's bad. It's something going on here. You, the mother, are scared and feeling uncomfortable with these thoughts of hurting your children because you're a good mother. And you're like, something's not right here. So even if a doctor says, don't be afraid to say if you're having those thoughts. Because maybe that's just the help you need. Like she talks about Red Leaf or Red Line. Red Leaf. I mean, which I'm so used to calling it the mother baby program. So that's why. But
maybe it is. I don't know.
That's names. What we have those programs for.
And if you do want to hurt someone, you have to talk to someone about it because most of the time people say, I want to kill my husband. And I'm like, coolsies, but not really. And they're like, no, not really. I just wanted to say it out loud like that. Doctors don't want to take you seriously and they won't if you're joking, like everyone's a human in this situation. But if you're like, last week I was going to bed and I was crying myself to sleep and I thought, I just want to end it. That would be something important to say to your doctor. Or they're not going to commit you for that most likely. I say most likely because I cannot guarantee to everyone what everyone's going to do. But
maybe if that's what you need, then that's the care you need.
And maybe that's the care you need. Or at the minimum, it's what keeps you safe in that moment so that you can continue on because living is the most important. So if you're at risk of suicide, Someone needs to help you because you might not be able to help yourself.
And if you, just like how Vanessa talked about how important sometimes just quiet is.
Yeah.
The grading. What if you have a colicky baby? And really, it would drive anybody fucking crazy.
Every baby who is colicky drives everyone around it crazy all the time. And if you're the mom and you have less support than usual, right? And that could mean many different things.
And it doesn't stop. And it's like what your brain sometimes needs is to be committed to get a break and a rest and a reset. And that is a beautiful thing.
I like video games and comic books. So I think about Daredevil in his, sensory deprivation chamber.
Yes. Yes. That's exactly it.
Yeah. Everyone thinks of the Ben Affleck movie, I'm sure. But
it can make a world of difference. Like, yeah. I was hoping you would share a funny story. So we do the momedies usually, and since you're a village mother, I was hoping you could tell a funny story about like any child, because you have a lot of children around you and they crack you up all the time. So can you think of any funny story about like...
Oh, I could talk about the story that I actually was referencing earlier about my cousin. It's a cute one.
Okay. Yeah, that's a good one.
Yeah. So I have a huge Irish Catholic family. So, there's like 1 million bunny children.
And you are one of?
I am one of 38 grandchildren from my grandmother, who was hilarious. She was a doctor and she was a big inspiration. She became a doctor in the 1940s. And one day I was talking to her and I was in my late teens and I was like, Grandma, you have so many kids and grandkids. And I was going to make a comment about something. And she's like, Vanessa, I'm going to stop you right there. I didn't even want any children. I don't think I was very maternal. And I'm like, Grandmother, you have like 48 people that directly came from like your body in a way. And she's like, yeah, well, that is what it is. But the funny tribe story I was going to tell is her youngest grandchild, and I'm her second oldest grandchild. My youngest cousin, she's so adorable. She was like very young, like 8 or 9. And I went to visit her and my aunt and uncle and her siblings. And when I was hanging out with her, her mom was like, Cousin Vanessa does cesareans and little baby, you were born by cesarean. And she was like, really? And I said, yeah. And this is like one of my favorite things to say to kids because they're always like, really? Or they get like scared and run away. I'm like, you should come apprentice with me. I think of like an apprentice blacksmith from the Middle Ages. And I'm like, you should come apprentice with me and learn how to cut babies out of bellies with me. You know, like this could get weird. I'm sure I'm going to have like a meme of me on the internet somewhere, like cut babies out of bellies, but it's a hilarious thing and kids, react various ways. And she didn't really react in a notable way that I remember, but then her mom, my aunt, called me like a couple of weeks later and she's like, so I just had breakfast with your youngest cousin, my daughter. And she said, Mom, thank you for everything you've taught me. This has been just like a really great experience, but I think you've taught me everything I need to know because cousin Vanessa seems to have like a skill set I don't have yet. And she offered to apprentice me. So I think it's time you let me go to cousin Vanessa's house and learn how to do that.
To say what though? So I can learn how to
cut babies out of bellies. Stop it. Now you just want my memes to roll in.
Right? I know. That's so funny though. And it was very serious too, wasn't it?
Very serious. She was like, I packed my bags, like that's how she was like, yeah, I'm ready, Mom. Like, and she was like, and I had to tell my 8-year-old, no, she had to go to, second grade, she couldn't leave yet. And I understood that going to cousin Vanessa's would be great, but it's not in the cards right now. So.
Yes. You have your own podcast. Do you want to go ahead and plug it?
I do. Sure. It should be dropped soon, but you know how podcasts are. Yes. We need to get our rate limiting step amount of, downloads done first or podcasts done first before we start to prepare for downloading. So it is called Going Down There.
Yes.
And it is a podcast about, vaginas.
Yes.
And women. And it is mostly me, an OBGYN, another OBGYN named Stan, an OBGYN nurse practitioner and family practice nurse practitioner named Hannah.
Yes.
And a group of willing compatriots.
Yes.
Yeah.
Okay.
So we're going to talk about healthcare and healthcare equity and research and vaginas today and endometriosis and everything.
And all the important stuff.
All the important stuff.
All the important stuff.
Yeah.
So awesome. Thank you for being on this season again. Thank you for being the
best
having me. Doctor ever. Awesome. All right. Take care, Mama.